Morning everyone. So in the today's lecture of ophthalmology, we will study about the entropion. In the last lecture, we was studied about the congenital anomalies of the eyelid. After that, in that we was study about the congenital coloboma, ptosis, congenital ptosis, and acquired ptosis. Then aponeurotic ptosis, mechanical ptosis and its treatment. Then epicanthus, dystiasis, cryptolphos and inflammatory disorders of the eyelid, that is the blepharitis. With seborrheic blepharitis, ulcerative blepharitis, posterior blepharitis, that is mebomitis, and parasitic blepharitis. After that, we was learn about the sty, that is external hordeolum. This is the diagram of the sty. This is the differential of the sty and the channel. Then we will learn about the channel. After the channel, we learn about the internal hordeolum. So this is a diagram of internal hordeolum of the lower eyelid. After that, we was studied about the molluscum contagiosum. This is a diagrammatic representation of molluscum contagiosum. Then, after that, we was study about the anomalies in the position of the lashes and the lid margin. That is, first one is the trichiasis. So this is a diagram of the trichiasis. In the trichiasis, there is an inward misdirection of the cilia with the normal position of the lid margin. So in that cases, there is a normal position of the lid margin, but there is the inward misdirection of the cilia. So this is a clinical photograph and this is a diagram of how the trichiasis is occurred. After that, from today, we will learn about other anomalies of the lid margin, that is the entropion. So entropion is defined as it is the interning of the lid margin. So in this diagram, we will see that how the entropion is occurred, that is interning the lid margin. This lid margin is interned. Types consist of, there are four types, that is congenital entropion, cicatricial entropion, spastic entropion, and senile, that is the involutional entropion. Firstly, we will learn about the congenital entropion. So congenital entropion, it is a rare condition seen since birth. Any anomaly that is occurred since birth, it is a congenital. It may be associated with the microphthalmos. So sometimes it may be associated with the micro. Then second one is the cicatricial entropion. It is a common variety usually involving the upper lid. So this is a diagram of the cicatricial entropion. In this, we see that how the involvement of the upper lid, and it is caused by a cicatricial contraction of palpable conjunctiva with or without associated distortion of the tarsal plate. So it is caused by cicatricial contraction of palpebral conjunctiva. These conjunctiva, that is the palpebral conjunctiva, shows the cicatricial contraction with or without distortion of tarsal plate. So it's result in a cicatricial entropion, that is the interning of mid margin due to the cicatricial contraction of palpebral conjunctiva. Next, that is third one is the spastic entropion. Spastic entropion, it occurs due to the spasm of the orbicularis muscles in the patient with chronic irritative corneal condition or after a tight ocular bandaging. It commonly occurs in old people and usually involve the lower lid. So, spastic entropion it is interning of the lid margin due to the spasm of orbicularis muscle. When there is a spasm of the orbicularis muscles in patients with a chronic irritative corneal condition or after a tight ocular bandaging, so it is commonly occurring in old people and it mostly involves the lower lid. The cicatricial entropion is seen in upper lid and the spastic is more seen in the lower lid. Fourth one is the senile, that is involutional entropion. It is a common variety and only affect the lower lid in elderly people. So this is a diagram of a senile entropion. It is commonly seen in elderly people and affect the lower lid of the eye. Then the etiological factors which contribute for its development are: first is the weakening or dehiscence of capsulobulbar fascia, that is lower lid retractor. When there is a weakness or dehiscence of the capsulobulbar fascia of lower lid retractor, it leads to the entropion. Second one is when there is a degeneration of palpebral connective tissue separating the orbicularis muscle fiber and thus allowing preseptal fibers to override the pretarsal fiber. So when there is a degeneration of palpebral connective tissue with separating the orbicularis muscle fiber and thus allowing a preseptal fiber to override the pretarsal fiber. And third one is the horizontal laxity of the lid. When there is a horizontal laxity of the lid, it leads to the entropion. That is the inward direction of the lid. Then fifth one is a mechanical entropion. It occurs due to the lack of support provided by the globe to the lid. Therefore, it may occur in a patient with a thysis bulbi and enophthalmos and after the enucleation or evisceration of operation. So, when this is a mechanical entropion is occurred, it is due to the lack of support provided by the globe to the lid. So when there is a lack of support provided by a globe to the lid is provided by a support to the globe, but when there is a lack of support, it lead to the mechanical trauma and lead to the mechanical entropion. Then clinical picture. So when we see clinically in a patient, the symptom what the patient told that occurred due to the rubbing of cilia against the cornea and conjunctiva and are thus similar to the trichiasis. These include the foreign body sensation, irritation, lacrimation and photophobia. So when, how this occur? That it occurs due to the rubbing of cilia, that is rubbing of cilia against the cornea and conjunctiva and are thus similar to trichiasis. And these lead to there is a foreign body sensation, irritation, lacrimation, photophobia. These are the symptoms of the entropion. Signs, the when we examine the patient, that we found that there is a lid margin is interned and depending upon the degree of interning, it can be divided into the three grades. In a grade 1, there is only the posterior lid border is enrolled. And in grade 2, Entropion, it includes the interning up to the intermarginal strip while in. And in grade 3, the whole lid margin, including the anterior border, is inter. So when we see the grade 1, there is only the posterior lid border is enrolled, and in grade 2 there is interning up to the internal strip, and in grade 3 whole lid margin including the anterior border is inter. So while seeing the clinical symptoms, clinically we will learn about how the symptoms and signs is seen in the patient of the entropion. So entropion is the process when there are cilia are internal. And the treatment entropion is that there is a similar to the trichiasis. Next one is a treatment. The treatment of congenital entropion require a plastic reconstruction of the lid crease. So there is a plastic reconstruction of the lid is required with the spastic entropion required to treat the cause of the blepharospasm. So when we treat the cause of the blepharospasm, which lead to the treatment of the spastic entropion. That is, for example, remove the bandage if applied or treat the associated condition of the cornea. And surgical treatment is also necessary. Third one is for the cicatricial entropion, which is treated by a plastic operation. And fourth one is the senile entropion, that is commonly used surgical technique. So, commonly surgical treatment is required to correct the entropion and its types. Next one is the ectropion. So, in that there is a ectropion is defined as when there is a outrolling or the outward turning of the lid margin, then it is called as the ectropion. So in the ectropion, there is a outrolling or outer turning of the lid margin. So there is a outward turning of lid margin. Then in this diagram, how we see the ectropion, that is the outrolling or outward turning the lid margin, that is exactly opposite to the entropion. Types, that is first one is a senile ectropion. It is commonest variety and involve only the lower lid. It occurred due to the senile laxity of the tissue of the lid and loss of the tone of the orbicularis muscle. So it occurs due to the senile laxity of the tissue of the lid and loss of tone of orbicularis muscle. So senile ectropion, it is the commonest variety of ectropion. It is seen mostly in the elder people in the lower lid. Second one is the cicatricial ectropion. Cicatricial ectropion, it is seen in this diagram that it occurs due to the scarring of the skin and can involve both the limbs. So it occurs due to the scarring of the skin. Common cause of the skin scarring are the thermal burns, chemical burn, lacerating injury and the skin ulcer. So when there is a thermal burn, chemical burn or the lacerating injury and the skin ulcer, then it leads to the scarring of the skin. It can involve the both leads. So this is called as cicatricial ectropion. So in this diagram, how we can see this is a case of the burn and which lead to the skin scarring and which lead to the cicatrial ectropion. Third one is a paralytic ectropion. This is a result due to the paralysis of the seventh nerve. It mainly occurs in the lower lid and common causes of the facial nerve palsy, that is a Bell's palsy, and head injury and infection of the middle ear. So, paralytic ectropion is occurred due to the paralysis of the seventh nerve. So, when there is the paralysis of the seventh nerve, that is the paralysis of the facial nerve, then it leads to the Bell's palsy. And this result in the paralytic ectropion. That is also a common condition, that is the paralytic ectropion is seen mostly when there is a paralysis of the seventh nerve, that is the Bell's palsy. So this is the third type of the ectropion. Then fourth one is a mechanical ectropion. It occurs in a conditions where either the lower lid is pulled down as in tumor or pushed out and down as in proptosis and marked chemosis of the conjunctiva. So mechanical ectropion is seen in the cases when there is a lower lid is pulled down as a tumor or push out and down as in proptosis and marked chemosis of the conjunctiva. When there is a tumor or as a tumor is present, then there is a condition where either the lower lid is pulled down as a tumor or pushed out. Then mechanical ectropion is formed. Fifth one is spastic ectropion. It is a rare entity seen in children and young adults following the spasm of the orbicularis where the lead are well supported by the glue. So when the spastic ectropion is a rare condition, it is seen in the young adult and children. And following the spasm of the orbicularis. So when there is spasm of the orbicularis oculi muscle, where the lead are well supported by the glove, this spastic ectropion is occurred due to the spasm of orbicularis. Then next is a clinical picture. So clinically, what the symptom and sign we see in the patient that epiphora is the main symptom in the ectropion of the lower lip. So epiphora, this is a main and important symptom of the ectropion. Symptoms due to the associated chronic conjunctivitis include the irritation, discomfort and mild photophobia. So the symptom due to the associated chronic conjunctivitis, which include irritation, discomfort, and the mild photophobia. Signs are, are as follows, that is, the lid margin is outrolled, and depending upon the degree of outrolling, ectropion can be divided into the three grades. So there are like in entropion, ectropion is also shows the three grades, that is in the grade 1 ectropion only punctum is everted, and in grade 2, that is the lid margin is everted and palpebral conjunctiva is visible, while in grade 3 there is a fornix is also visible. So when there is a ectropion is formed, that is the outrolling or outer turning of the lid margin, then when we see the sign, the lid margin is outrolled, and in grade 1 the only punctum is everted. But in grade 2 the lid margin is also everted and palpebral conjunctiva is also everted. And in grade 3 the fornix is also visible. So depending upon the grade, the ectropion can be seen in a patient. That signs of the etiological condition such as skin car in the cicatricial ectropion and seventh nerve palsy in the paralytic ectropion may also be seen. So, there is a skin carring in cicatricial ectropion and seventh nerve palsy in paralytic ectropion is also seen. That was done in the previous slide. Next is a complication. So, the prolonged exposure may cause a dryness and thickening of the conjunctiva and corneal ulceration, that is exposure keratitis, eczema, dermatitis may occur due to the prolonged exposure, and treatment is that surgery. So, complication is that when there is a prolonged exposure to the external condition, then it lead to the dryness, thickening of conjunctiva and corneal ulceration. So it lead to the corneal ulceration. That is the exposure keratitis. And when there is eczema, dermatitis may occur due to the prolonged epiphora. So when there is the epiphora is prolonged, then it lead to the eczema and dermatitis. So next topic is the Symblepharon. Symblepharon is a condition when the lid becomes adherent with the eyeball as a result of the adhesion between the palpebral and the bulbar conjunctiva. So, etiology of this is that it results from healing of a kissing raw surface upon the palpebral and bulbar conjunctiva. It is common causes are the thermal or chemical burn, membranous conjunctivitis, injury, conjunctival ulceration, ocular pemphigus, and Steven-Johnson syndrome. So, Symblepharon is a condition that when lid become adherent with the eyeball. So, as a result of adhesion between the palpebral and bulbar conjunctiva. When there is a adhesion between palpebral and bulbar conjunctiva, it results in a lid adherent with the eyeball, so which lead to the Symblepharon. Clinical picture is that it is characterized by difficulty in the lid movement, that is diplopia due to the restricted ocular motility, inability to close the lid, that is leg ophthalmos, and cosmetic disfigurement. So, clinically, when we study that, we can see diplopia, inability to close the lid, that is leg ophthalmos, and cosmetic disfigurement is seen in this case. Though this is a diagrammatic depiction, that is the anterior Symblepharon. This is A. This is the anterior Symblepharon. This is a posterior Symblepharon. That is diagram B. And C. That is the total Symblepharon. So, clinical photograph of anterior, this is this one, and posterior Symblepharon. So, in this diagram, we can see how the adhesion between the conjunctival and palpebral part of the conjunctiva. Palpebral and bulbar conjunctiva adhesion is seen in these cases of anterior and the posterior symblepharon. Then, fibrous adhesion between the palpebral conjunctiva and bulbar conjunctiva and or cornea may be present only in the anterior part, that is the anterior symblepharon, or fornix, that is the posterior symblepharon, or the whole lid, that is the total symblepharon. So, when we study that how the fibrous adhesion between the palpebral and bulbar conjunctiva is formed, the cornea may be present on anterior or fornix, that is posterior. and the whole lid. So this is called as the total symblepharon. When there is an adhesion occur anteriorly part, then it is called as anterior symblepharon. And it occur in a posterior part, so then it is called as posterior symblepharon. And when the adhesion is totally present in the anterior and posterior part, that is in the bulbar and the palpebral part of the conjunctiva, then it is called as the total symblepharon. So complication these include the dryness, thickening and keratinization of the conjunctiva due to the prolonged exposure and corneal ulceration. So these include the dryness, thickening and keratinization of conjunctiva due to the prolonged exposure and the corneal ulceration and exposure keratitis. So treatment is that prophylaxis can be used in such cases. So during the stage of the raw surface, the adhesion may be prevented by sweeping a glass rod coated with the lubricant around the cornices several times a day. A large size therapeutic and soft contact lens also help in preventing the adhesion. So when there is a Symblepharon is seen, the prophylactic we can use in that case, the adhesion may be prevented by sweeping a glass rod coated with the lubricant around the cornices several times a day. And last side therapeutics, that is soft contact lens, may also help in preventing the adhesion. Curative treatment that consists of the symblepharon, so it requires a surgical treatment. Next is the Ankyloblephron. So, what is Ankyloblephron is that it refers to the adhesion between the margins of the upper and the lower lip. It may occur as a congenital anomaly and may result after healing of a chemical burn and thermal burn, ulcers and traumatic wound of the lid margin. So, Ankylophoron may be complete or incomplete and is usually associated with the Symblepharon. So, when there is an adhesion between the margin of upper and lower lid, then it leads to the Ankylophoron and it occurs as a congenital anomaly and may result in the healing of chemical burn, thermal burn, ulcer, traumatic wound and lid. So treatment is that the lid should be separated by the excision of adhesion between the lid margin and kept apart during the healing process. These adhesion extend to the angle epithelial graft should be given to prevent the recurrences. So when the adhesion extends to the angle, there is a epithelial graft should be given to prevent the recurrences. Next is a Blepharophimosis. So this is a condition the extent of palpable fissure is decreased. There is a decrease of extent of palpable fissure and it appears contracted at the outer canthus. So there is a contraction of outer canthus which leads to the blepharophimosis. Etiology is that it may be congenital or acquired due to the formation of the vertical skin fold at the lateral canthus, that is the epicanthus lateralis, following the eczematous contraction. Treatment is usually no treatment is required in these cases. In marked cases, canthoplasty operation is formed. Sometimes it requires no treatment when there is a small extent, but when it occurs in a large extent, it requires a surgical intervention, that is the canthoplasty. So this is a condition when there is the extent of palpable fissure is decreased and there is a contracture at the outer canthus, it is called as blepharophimosis. Next one is a leg of Tumours. It is also an important and characteristic condition when there is a inability to voluntarily close the eyelid. So it is very dangerous condition. When there is an inability to voluntarily close the eyelid, This is called as the leg of thymus. It occurs in a patient with the paralysis of orbicularis oculi muscle, cicatricial contraction of the limb, Symblepharon, severe ectropion, proptosis following over-resection of the levator muscle for the ptosis, and in a comatose patient. Physiologically, some people sleep with their eye open. This is a nocturnal leg. So, leptospirosis is a condition when there is an inability to voluntarily close the eyelid, and it is mostly seen when there is a paralysis of oculus oculis, when there is a cicatricial contraction of the lid margin, when there is a symblepharon, when severe ectropion or proptosis or levator muscle ptosis or in a comatose patients. But sometimes physiologically also in some people it is seen, so it is called as a nocturnal leg of thymus. Then clinical picture is that it is characterized by the incomplete closure of the palpebral aperture associated with the features of the causative disease. So it is characterized by an incomplete closure of the palpebral aperture associated with the feature of causative disease. It includes a conjunctival and corneal xerosis. So, due to the inability to voluntarily close the eyelids, lead to the conjunctival or corneal xerosis and exposure keratitis. So, these are the complications of leg ophthalmos. Hello, good morning, बोला. Hmm. Okay, ठीक है sir. Thank, thank you. So, next is the treatment of the leg ophthalmos is that to prevent exposure keratitis, artificial tear drops should be instilled frequently and the open palpebral fissure should be filled with an antibiotic eye ointment during the sleep and in comatose patient. Soft bandage contact lens may be used to prevent exposure keratitis, and tarsorrhaphy may be performed to cover the exposed cornea when indicated. The measures should be taken to treat the cause of leg ophthalmos wherever possible. So, when we treat the leg ophthalmos, it is to prevent exposure keratitis. Artificial tear drop is useful but should be instilled frequently, and the open palpebral fissure should be filled with an antibiotic eye ointment during the sleep and in comatose patient. So when there is a comatose patient or during the sleep the leg ophthalmosis occurs, we can use antibiotic eye ointment, and soft bandage contact lens may be used to prevent exposure keratitis. So to prevent a complication of leg ophthalmos that is exposure keratitis, soft bandage contact lens can be used. Tarsorrhaphy may be performed to cover the exposed cornea when indicated, and measures should be taken to treat the cause of leg ophthalmos wherever possible. Next is a blepharospasm. So blepharospasm is occur when involuntary, sustained, and forceful closure of the eyelid. So there is an involuntary condition. Sustained and forceful closure of the eyelids lead to the blepharospasm. Blepharospasm occur in a two forms, that is the essential or the spontaneous blepharospasm. It is rare idiopathic condition involving a patient between the 45 and 65 year of the age. Second is reflex blepharospasm. It usually occur due to the reflex sensory stimulation through the branches of the fifth nerve. In the conditions such as phylacteal keratitis, interstitial keratitis, corneal foreign body, corneal ulcers, and iridocyclitis. So, it is also seen in excessive stimulation of the retina by the dazzling light and stimulation of the facial nerve due to the central causes and in some hysterical patients. So, when there is a blepharospasm, that is the involuntary, sustained, and forceful closure of the eyelid, so it occurs in a two form, that is essential or spontaneous. So it is an idiopathic condition and seen mostly in a 45 to 65 year of age. And second is the reflex blepharospasm. It is seen due to the reflex of sensory stimulation through the branches of the fifth nerve. In the conditions such as phylacteal keratitis, interstitial keratitis, corneal foreign body, corneal ulcer, and iridocyclitis, and it is also seen in the excessive stimulation of the retina by the dazzling light and stimulation of the facial nerve due to the central cause, and in some hysterical patients it can be seen. So clinical features are that when there is a persistent epiphora may occur due to the spasmodic closure of canaliculi, which may lead to the eczema of the lower lid. And edema of the lid is frequent. So there is a persistent epiphora due to the spasmodic closure of the canaliculi and which lead to the eczema of the lower lid with the edema of the lid. Spastic entropion in the elderly people and spastic ectropion in the children and young adults may develop in a long-standing case. So, in a long-standing cases, there is spastic entropion in elders and spastic ectropion in children and young adults is seen. In blepharophimosis may result due to the contraction of the skin fold following the eczema. So, blepharophimosis it results in a due to the contraction of skin fold following eczema. After the eczema, there is a contraction of the skin fold which results in the blepharophymosis. Treatment in essential blepharospasm, botulinum toxin is injected subcutaneously over the orbicularis muscle and block the neuromuscular junction and relieve the spasm. The facial denervation may be required in a severe cases. In a reflex blepharospasm, the causative disease should be treated to prevent the recurrences, and associated complications should be treated. So, in the reflex blepharospasm, there is a causative disease treatment is more essential and associated complications should be treated. And in the essential blepharospasm, the botulinum toxin is injected. The next topic is the tumor of the lid. So, tumors of the lid are almost all type of the tumor arising from the skin, connective tissue, glandular tissue, blood vessel, nerve, muscle can involve the lid. A few common tumors are listed and only the important ones are described here. So, the classification is that first one is a benign tumor. That these include the simple papilloma, nevus, angioma, hemangioma, neurofibroma, and sebaceous sarcoma. The precancerous condition, these are the solar keratosis, carcinoma in situ, ectoderma pigmentosa, and in malignant tumor, these commonly observed tumors include the squamous cell carcinoma, basal cell carcinoma, malignant melanoma, and sebaceous gland adenocarcinoma. So, tumor of the lid shows the tumor of the skin, connective tissue, glandular tissue, blood vessel, nerves, and muscles can involve the lymph. And classification of that benign tumor, precancerous condition, malignant tumor. So these are the diagram in that we see the how the benign tumor is seen of the liver. First one is a papillomas, second is a xanthelasma. So this is a xanthelasma, this one. This is the benign type. Hemangioma, fourth is a neurofibroma, this is a neurofibroma. Then the malignant tumor, that is a basal cell carcinoma, squamous cell carcinoma. This is a diagram of the squamous cell carcinoma. In that we can see the how the tumor form on the lid. Then sebaceous gland carcinoma and malignant melanoma. That is the melanocarcinoma, and the last one is a treatment. So carcinoma when malignant, then it requires only a surgery. Surgical treatment is useful for the malignant tumor as well as a benign tumor, but in some cases we can use homeopathic medicine. But homeopathy also have some limitations to treat the tumors of the liver. So, in the today's topic, we learn about the all the anomalies in the position of the lashes and the lid muscle. That is trichiasis, that is referred to the inward misdirection of the cilia. That is, this is diagrammatic position of trichiasis. This one, that how the cilia are inward misdirection. Then its etiology, signs, symptom, clinical feature, complication, treatment. Next is the entropion, that is interning of the lid margin, that how the lid margin are interned. And its type, that is congenital, cicatricial, spastic, and senile entropion, which is etiology, clinical features, that is signs, symptom, complication, and treatment. Next is the ectropion. Ectropion is that there is an outrolling or outer turning of the lid margin. And it is mostly seen in the elder people and in the lower. So, when there is an outrolling or outer turning of the lid margin, which is called as ectropion, and its type that are senile ectropion, cicatricial ectropion. When in the one case, you can see a cicatricial ectropion due to the scarring of the skin, paralytic ectropion, mechanical ectropion, spastic ectropion. This is clinical features, signs, symptoms, complication and treatment. And next topic is a Symblepharon. In this condition, the lid becomes adherent with the eyeball as a result of adhesion between the palpebral and bulbar conjunctiva. So when there is an adhesion between the palpebral and the bulbar conjunctiva, then it leads to the adherent of the eyeball. So when it adheres anteriorly, then it is called as the anterior symblepharon. When it adheres posteriorly, then it is called as the posterior symblepharon. And when it adheres totally, bulbar and palpebral conjunctiva is totally adhered, then it is called as the total symblepharon. That it's seen in the clinically that how the anterior symblepharon is formed and the posterior symblepharon is. So this is the adhesion between the palpebral and bulbar conjunctiva. and posteriorly, and this is the adhesion when anteriorly palpebral and bulbar conjunctiva adhesion shows in an anterior symbol. Then its complication, treatment. Next topic is the Ankyloblephron. In that it was studied that it refers to the adhesion between the margins of the upper and lower limb. So there is an adhesion between the margins of upper and lower limb and to occur congenitally. Its treatment. Then next is the Blepharophimosis, that is the extent of palpebral fissure is decreased and it appears contracted at the outer canals. Its etiology and the treatment. Next is the leg of thermos, that is, it is characterized by the inability to the voluntary close the eyelid. So when there is an inability to close the eyelid voluntarily, it leads to the leg of thermos. Its etiology, clinical features, and the complications shows that there is a orbicularis muscle paralysis, cicatrial contraction of the lid, Symblepharon, severe ectropion, proptosis following the over-resection of the levator muscle for the ptosis, and in comatose patient physiologically, some people sleep with their eye open with the nocturnal, this is called as the nocturnal leg of thymus. Then clinical picture is that it is characterized by incomplete closure of the palpebral aperture associated with the feature of the positive disease and its complication. Treatment. Then next is the it refer to the blepharospasm, that it refer to the involuntary sustained and forceful closure of the eye. So when there is an involuntary, sustained and forceful closure of the eyelid, it is called as blepharospasm. It is seen in the two forms, that is essential or spontaneous blepharospasm, and next is the reflex blepharospasm. Its clinical feature and treatment. Then last topic is the tumor of the lid. So tumor of the lid is almost all type of the tumor arising from the skin, connective tissue, glandular tissue, blood vessel, nerve, muscles, and can involve the lid. And a few common tumors are listed, and only the important ones are described here. That is the classification of benign tumor, precancerous condition, and the malignant tumor. So first one is a papilloma, xanthelasma, hemangioma, neurofibroma, malignant tumor, that is the basal cell carcinoma, squamous cell carcinoma, sebaceous gland carcinoma. Fourth is the malignant melanoma and melanocarcinoma. And treatment is the surgery. So surgery is the treatment useful in the tumors of the liver. So for today we can stop here, and in the next lecture we will learn about the homeopathic therapeutics for the diseases of the eyelid. So diseases of the eyelid is a very vast topic, and there are the many types of the diseases of the eyelid, that is congenital and inflammatory disorder of the eyelid, in that blepharitis, types of blepharitis, and congenitally there are many types of the congenital anomalies of the lid. So there are many topics like ectropion, entropion, ptosis, size, that is external hordeolum, chalazion, leg of thalmos, acute blepharitis, chronic blepharitis. So these are the many topics which are included in the diseases of the eyelid. So next in the next lecture, we will learn about the homeopathic therapeutics for the diseases of the eyelid in general. So for the today's we can stop here. So have a good day. Bye.